Welcome to the Fireside Chat series. My name is Gray Campbell. I have Dr. Keith Smith here today, and he is going to present a hot topic. We're going to learn about the healthcare free market option where pricing is bundled, transparent, and affordable. It's a little bit different than what we're all used to, and it actually brings us back to the basics. And so I'm going to let, Dr. Keith Smith speak in a moment, but first I want to introduce Heath Potter. Heath Potter is with us from 6 Degrees Health. Hi, Heath.
How we doing, guys? Good to see everybody.
Welcome to the show, everybody. In case you have missed it, the Fireside Chat series is created for you. We built this back in 2020 for you, our business partners, and everybody in the benefits industry in order to bring healthcare and bring the benefits into a nice space to chat about casually. We host these once a month and we feature all kinds of industry and content experts. Right now we have Dr. Smith, who I'll introduce in a moment, but I do want to thank everybody for coming. Who is 6 Degrees Health? We are a service first cost containment company. We work with all kinds of different employer groups that choose to self-fund. We also work with the fully funded model as well. So whether you're with a traditional network or you're using an open access plan, we got you. Come take a look at our website, 6degreeshealth.com, if you want to learn more. We are very proud to bring integrity to what historically amounts to an opaque billing practices industry. We'll get into that today. And we also leverage unparalleled clinical expertise and innovative data technology to empower these employer groups, small and large and medium as well, so that their covered employees can realize the true benefits of healthcare. So that's what we do here at 6 Degrees Health. Now, I do want to introduce Dr. Keith Smith. Dr. Smith is calling in from Oklahoma. Welcome, Dr. Smith.
Thank you. Thanks for having me.
You bet. So Dr. Smith is a huge proponent of an independent free market approach. He runs a surgery center in Oklahoma. It's the Surgery Center of Oklahoma that really focuses on transparent web displayed pricing. This is exclusive. He's exclusive board certified medical staff. He's got a business model that attracts self-insured companies like yourself and uninsured. We call them medical refugees. In other words, some Canadians that pop down for some medical services as well. It's a completely physician-owned practice that is emphasizes some unsurpassed quality of care and service with low market-based pricing. So the market-based pricing is the piece that we're going to get into today. And I believe this too. The future of healthcare and reimbursement hasn't been written yet. Dr. Smith's got some ideas on how he sees that it should be written. So consider taking back your health plan, folks. This is a way that you can find a new direction in healthcare reimbursement. So, Dr. Smith, tell us a little bit about yourself today.
Well, thanks again for having me. I appreciate the opportunity. I put a slide deck together mainly to guide me through this because I invariably will give a talk like this and leave something out. But I'll give you some background about myself, about the Surgery Center of Oklahoma, why it was founded, and how I believe it's responsible for launching what can only be described as a revolution in the industry, and give some examples about that's not just some crazy claim, and it's not a proof of concept stage. This is very far along. So I think it's good for everyone in the industry, no matter what their role is, to be aware of what's going on. So I'm an anesthesiologist. I started my private practice in Oklahoma City in 1990. I was recruited to Oklahoma City to do cardiac anesthesia primarily, but I was also pediatric fellowship trained, and I loved doing pediatric anesthesia. That really was what I loved, that and cardiac anesthesia. I'd been in practice a couple of years when all of the price cuts started from the resource-based relative value scale experiment, which I would argue is a complete failure. And we noticed that physician fees were going in the toilet. and hospitals were making a lot more money than they ever had. The patients were being billed exorbitant amounts for the first time in anyone's memory, starting in the early 90s. So it was clear that people were benefiting from what was going on in the industry. It just was not the physicians who were doing the work, and it was not the patients who were receiving the care. So in 1997, Steve Lantier, another anesthesiologist, and I decided that we could no longer be a party to what the equivalent of a drive-by shooting basically was a criminal enterprise, and we were accomplices, and we did not want to enable the robbery of patients that were in the hospital. So as anesthesiologists, really the only thing we could do about it was own and control our own facility. So in 1997, 7 years after I'd been in practice, we walked out. Now, we had very successful, lucrative practices, and we walked out. We had gained control of a burnout, about to fail surgery center on a hunting trip, which is another story I could talk about for an hour. But we started in 1997 with some very simple rules. We decided we would only work with surgeons that we would let work on us. We decided patients would always know what they were going to pay us before they arrived. There would never be any surprises later. And we also decided we would never accept a dime of money from the government, and we never have. So we launched in 1997. We were wildly successful from the very beginning. The word spread. And it happened so quickly that our first week we were open, the phone rang, and a patient had a breast mass she needed removed, and she asked us how much that would be. And we were very excited. This was the call, we were hoping for. We wanted to provide great care at a reasonable price. The only problem I had is I didn't know the answer to her question. But thanks to her and that early call, I really had to figure out how to price surgeries early on. And I'd argue that I've become fairly good at it. So I called the surgeon. This first thing I did and asked him how much he wanted for a breast biopsy. And of course, he had no idea. So I told him to pick a number, or like one of the networks or Medicare, I would pick a number for him. So he said $500, and I thought that was very fair, cheap, if anything. So I hung up on him before he could change his mind. As an anesthesiologist, I bill for my time. That's not 100% true, but it's mostly true. And I knew this was going to be a 20 or 30-minute surgery at the most. So I kind of had in my mind what I was going to charge for my anesthesia service. Having performed enough, been part of enough surgeries, I knew the supplies for this procedure were going to be minimal. So I had an idea in my head about how much are these supplies going to cost to perform this surgery, and it wasn't very much. And I was about to take her off hold. She astonishingly had not hung up by this point, when I realized she was going to want to know if she had cancer. So I called a pathologist friend and I asked him, how much do you want to examine this specimen? And he said, I don't have any idea. And then I said, my gosh, pick a number. And he said, well, about $28. So I added it all up, took her off hold, and I told her the price is $1,900. And she said, for what? And I said, well, for everything. She said, well, that's interesting. The not-for-profit hospital down the street from you wanted $19,000 just for the facility. And so she came, got her care. We got everything done. I sharpened my pencil after the case and realized we had made a profit. And that was our price for a breast biopsy until about 2011, when the pathology charges went through the roof, thanks to some genetic marker stuff. And so that price went up to $2,365. So our prices that we quoted over the phone in 1997 were really the same as they were when I launched the website in 2009, which I'll explain here in a minute. So
awesome.
Go ahead.
Go ahead. I just wanted to move the slideshow along, Dr. Smith. and just introduce the previous slide that we had up. Can we go back just one slide so we can look at the agenda today? First of all, thank you for explaining that story. I don't think we got into that specifically last time, Dr. Smith, but we are going to be getting into how this billing works, and specifically Atlas billing, and learn more about that. But I do want to show this slide, our agenda today. Once again, the topic is the healthcare free market option, where pricing is bundled, transparent, and affordable. Again, we're learning about Dr. Smith right now, why he decided to start posting these prices online. I think we've got a good understanding of that. We're going to look at the goals of transparent pricing, and we're going to talk about that. And then we're going to talk also about where the future is headed, how can we incorporate some of these ideas into healthcare. It's already happening at the Surgery Center of Oklahoma, but how can we expand this into other markets? Again, folks, and I didn't mention this, please use the Q&A function. We have a chat box you can use. Feel free to use that for fun. But if you've got questions for Dr. Smith, myself, or Heath, please use the Q&A function, and we will, I promise you, we'll get to those questions at the second half of the hour. So Dr. Smith, let's move on to that next slide. And then let's get in specifically into one more up. Perfect. Let's talk about the Surgery Center of Oklahoma and talk about the website that you have for that transparent pricing, please.
So after quoting prices for a while, filing out of network claims, we'd made many enemies, the hospitals and the insurance carriers, as you can imagine. And they tried everything to shut us down. I spent far too much time at the state capitol with various battles. And in about 2004, the state insurance commissioner in the state of Oklahoma allowed the insurance carriers and the networks to stack deductibles. We were shunned from all networks, which was confusing to me because we were cheaper and better and everybody knew it. So we didn't understand blacklisting at the time. And so we went from being a very busy surgery center in a new building, the front of which you can see in this slide, to just having an empty waiting room. And we struggled, and I shook my head. And I thought, we're cheaper and better in a competitive market space. There should be a line around the door. And in 2009, I launched the website that you see in front of you, surgerycenterok.com. I decided I'm just going to put all of our prices online. It had occurred to me that I'm going to call my friends who own and run self-funded companies and just ask them, how much are you paying for a gallbladder surgery? How much are you paying for a tonsillectomy? How much are you paying for a knee replacement? And when they answer me, I'll beat their price. And then I thought, no, I'm going to just show all of our prices to everyone. I'm going to post them online. And that way, the three goals in my head could be achieved. Number one, we make ourselves more known to the buyers with sticker shock, whether it's individuals, cost-sharing ministries, self-funded plans. Number two, we would put these big price gouging hospitals on notice, and they would be in a position, they would find themselves perhaps in a competitive marketplace where they would have to price match. And patients could use our pricing to leverage a better deal wherever they lived. But my third goal was to better understand the scams that will work, because the free market is powerful and it will work unless something, usually government, is in the way. So I launched this website in 2009. These are current pricing. You can look through those. Almost everything that we do is listed on that site. If you want a complete list, I can email you a complete list with pricing and CPT codes. And all of these prices are bundled. So it's surgeon anesthesia facility, it's everything. It's not, no one's going to get a bill later from someone. It's just, everything you see is bundled. So we launched this website in 2009, and the first patients who arrived were Canadians. And that was instructive because, they all have coverage, whatever that means. They just don't have access to the care that many of them require. So Canadians came, and then uninsured folks came, and the word spread. And then I met Jay Kempton, who runs a third-party administrator called the Kempton Group. And I began to deepen my understanding of self-funding and what the needs of those buyers are. We were self-funded at the Surgery Center of Oklahoma with 28 employees, and had just saved an outrageous amount of money by going that route. So we connected with Jay Kempton, and his clients started buying from me. Gray, I'm getting a message that says somebody can't hear, but you guys can hear me, I guess.
Yeah, I can hear you just fine.
Excuse me. I think that particular guest, it's on their end. So yeah, we've got I can hear you from other folks. So
okay,
keep talking, Dr. Smith.
Okay, so the goals that you see in front of you are really what I had in mind when I launched this website in 2009. So I don't think I can advance the slides, but I think you can, Gray.
Oh yeah, no doubt. We'll advance that to the next one for sure. Great.
So
go ahead.
Go ahead.
No, I was going to say, it looks like this slide gets into some of the financials. Let's talk about that.
Yeah. So Jay Kempton, he realized that he needed to change his business model as a third-party administrator in a way that from my perspective as a seller in the marketplace, I don't like the word provider, as a seller in the marketplace, I needed for the exchange to look, smell, and feel like a cash transaction. I couldn't be chasing the patient around the kitchen island trying to get their copay and their deductible. And so he challenged his team to make the exchange look like a cash transaction. So he started a new tier and a new program that was Kempton Premier, where the bill was paid at 100%. So I don't file a claim like most people do. I send the Kempton Group an invoice. It's one page, and they pay from an invoice, and they pay 100% of the amount. And it's that simple. And I'm usually paid in 5 to 7 days. And that they are happy to do that, and their clients are, because of the difference in what they would pay if they went to one of the price gouging hospitals in my area or anywhere else. So the most astonishing part of this slide, I think, is the bottom half. You see $106 million total estimated savings. That is over a period of 9 years with an average number of lives of 20,000. So when Jay started working with me, I think he had about 12,000 lives, and now he has about 70,000 lives. But a lot of that growth is just in the recent 2 years. So with an average number of lives of 20,000 lives in 9 years, his client saved $106 million. And those are using comparative numbers that are actually average PPO rates paid. So now that's not using ChargeMaster numbers. That's using realistic payment numbers. I find the $106 million number to be shocking and astonishing. But it's an example, and you can extrapolate that out. I mean, however large a group you want, or a smaller group you want to think about over that period of time, that sort of fluff has been absconded with by the big bureaucracy that's our industry.
That's go ahead.
We can go to the next slide if you want, unless
Perfect.
you want to talk about that one.
No, let's keep moving. I do want to get into your billing company and, talk to you about how you built that out and how successful it is.
So when I launched the website, I knew that whoever was paying me was going to want to write one check. They were not going to want to pay surgeon, anesthesia, facility, radiologist, home health, pathology. They were going to want to write one check. So smart thing I think I did is I established a clearinghouse to which that single payment could be made. And then I control the clearinghouse. So then I pay the surgeon, anesthesia company of which I'm a part, surgery center, pathology, radiology, whoever needs to be paid. And this billing company is called Atlas Billing Company. Well, I had no idea at the time the other services that Atlas Billing could actually offer to this sick industry. One of the things that happened when I started working with Jay Kempton was his competitors started working with me. So there were many other TPAs that wanted to buy from Surgery Center of Oklahoma at our prices. It was great for their clients, but they were also a little bit afraid their clients would all end up under Jay Kempton's umbrella. And he was not all about exclusivity, and I wasn't either. I was actually teaching the surgery centers how to do this. Well, eventually, I got the call, hey, we've got a patient with colon cancer that needs their colon removed. How much for that? Well, we're an outpatient surgery center, so we can't do that. So I picked up the phone because I wanted to create and really deliver as much value as I could. And I called a surgeon who worked at a hospital who I knew was fairly reasonable to work with. And I said, will your hospital have a price conversation with me? And he said, yeah, I think they will. So I wind up talking to the CFO and I said, well, how much do you want for a colon resection? Well, let me call you back tomorrow. I think we can figure that out. Well, one thing led to another, and I found myself curating, putting together these bundles for inpatient surgery, whether it's open heart surgery, whether it's pituitary tumors, all kinds of big spine procedures. And I was, creating and putting these bundles together, and everyone involved in the bundle knew that, there's kind of a kumbaya. No one could misbehave in the bundle or the bundle was soiled. And so there's this discipline that is inherent in self-policing whenever someone participates in a bundle, because if they go rogue and maverick and they bill outside of the bundle, they know I'll never call them again. So, and they get paid fast and they're not chasing copays or deductibles. They get basically whatever we agree to. So Atlas Billing Company became this clearinghouse through which employer groups that I deal with can buy inpatient services. And the reason the hospitals were okay with this is Atlas actually cloaked them from the carriers with whom they had contracts. And some of them are kind of afraid, if we give a great price and that's better than contract with network X, is that a problem? Well, the prices you're looking at on this slide, colectomy, the example I just gave, that's the total. There is no clue about how much the hospital is being paid inside of that. And I keep that very, very close to the chest. You look at, there's colon resection, 24,500. That's the total. That is not, that's not the hospital fee. That's the bundled fee. So Atlas kind of served as a cloaking device, also served kind of as a coordinating curator. And I decided I was going to post these inpatient prices also on this separate website. So that the other point I think that's important to make is, as much as hospitals attacked me, attacked Surgery Center of Oklahoma, attacked price transparency, attacked all of these ideas of a competitive marketplace, they're now participating in it. And that is a tribute to the power of the free market. Because if I call a hospital in Oklahoma City and I say there's a fellow from Florida who has a meningioma, a brain tumor, they're going to give me a price because they know the hospital down the street from them is going to give me a price, and they want that business and it has worked beautifully. And I know that while the hospital association is just screaming that, price transparency is impossible, I'm here to tell you they're doing it. They know exactly how to do it. Whether they decide, we're going to take all of our rates and do 100%, 160 or 180% of Medicare. They all have different ways of doing this. But the hospitals I'm dealing with that are participating and whose prices, many of which are posted at the Atlas website, they become very good at this, including maternity. Very complicated bundles. So you've put up the next slide, FMMA, the Free Market Medical Association. The Free Market Medical Association was Jay Kempton's brainchild. All of his competitors wanted in on this. All of my competitors, surgery centers and hospitals, physicians, they wanted in on this. Stop loss carriers were very interested in this. Many vendors, yours included, have been interested in this. And so Jay said, let's start an association where people can get together and network, and we can have conversations between buyers and sellers without all of the noise and interference that the intermediaries typically bring to the table. And only intermediaries and vendors who decrease the friction of the exchange between buyer and seller would be allowed. So we started this organization, I think 8 years ago now, and it has grown. We've had Steve Forbes, Ron Paul, Kennedy from Fox Business. We've had some great keynote speakers and very successful large gatherings. We don't know where our next one's going to be for our annual meeting. It'll probably be in April, and we'll hope to see everyone there. But we'll make that clear as soon as we know. So on the Free Market Medical Association's website, there's a tab called Shop Health, and it's there that you can find the pricing of all of the members who are sellers. That's where they post all of their pricing. So if you're wondering if a hospital is price gouging your clients, that's an easy reference. You can look there and see.
Now, thank you, Dr. Smith. That's a very, I really, from my perspective, I'm pretty new to the industry still. And, I guess, one of the questions I have for you is, how do you expand this, or how is this expanding across the country? Obviously, this started back in the 90s at the Surgery Center of Oklahoma. You've introduced the Atlas Billing Company and creating a clearinghouse. How do people you mentioned Florida, how do people in Rhode Island, how do folks utilize a service like this?
Well, locally, the free market sellers are limited pretty much to facilities that are owned and controlled by physicians. They tend to be more tightly controlled and more able to participate in this movement, more nimble. So if you're in a state like the People's Republic of North Carolina or Rhode Island, where they have certificate of need laws that prevent open competition, then it's slim pickings. There's not much to pick from. What we found, though, is that patients are voting with their feet. On any given week at the Surgery Center of Oklahoma, 40% of our patients come from out of state.
Wow.
So patients are traveling. Third-party administrators are paying their travel expenses. We have one employer we work with who pays 100% of the bill, all of the travel expenses for the patient and a companion, and gives the patient a stipend, any unused portion of which is theirs to keep. So, that pays all of their incidentals with plenty to spare. And of course, the reason for this is obvious. If you're saving $20,000 by buying a $6,000 gallbladder surgery, then there's some room, to provide incentives. So this movement is growing because self-funded buyers basically are voting with their feet, and they're willing to step outside of the box and consider domestic medical travel And this movement is growing because the self-funded buyer is just such a gorilla in the marketplace, and even the big hospital systems cannot ignore. So in areas where there is only one hospital or it's monopolistic, the best advice I can give a self-funded employer there is launch a travel program. And eventually the monopolistic price gougers get the message, and they want to stop that because they know once these dominoes start to fall and patients are comfortable traveling and they come back and at the water cooler tell everybody how wonderful their experience was, then that's a real problem for that local price gouger. And they've got to step up, and we've seen this time and time again. The slide in front of you, I bash. Everybody I think needs bashing. The hospitals need bashing. The networks, the carriers, they need bashing. Pharma needs bashing. But the ultimate scammer of them all is Uncle Sam, because none of what Americans hate about this industry is possible without Washington auctioning off all of these favors to the cronies. So I tell people, Dave Chase talks about the great heist. And I remind people that Uncle Sam is driving the getaway car every single time. So the ultimate scammer is Uncle Sam. And all the others are just doing, what they've paid for to do all these favors, and all of our liberties just auctioned in DC. So I think it's an important point to make, because there's so many people in the country that think we need to go to the government to solve this problem. Well, the government caused all the problems. So, they are not where we need to look. And this free market movement is the opposite of that movement. We know it is a very grassroots, ground up movement that wants nothing to do with the fool and the scammer that you see in front of you.
So, Dr. Smith, are there other folks out there who have come up with a similar model as you? I mean, you're talking about what you're doing in Oklahoma. Are you starting to see other things pop up?
Yes, there's basically a carbon copy of Surgery Center of Oklahoma now in Indianapolis. It's called Wellbridge Surgical, and they're worth checking out. There's a carbon copy in Charlottesville, Virginia. There's one in Utah. There's one in California, two in California. There's one opening in Houston. There's another one in Houston. There are two in the Dallas area, two in the Austin area. It's primarily kind of in the heartland, but I want to be clear, there are hospitals that are participating in this movement. They are just not out of the closet. There are hospitals that are price matching my website pricing, but they kind of don't want anybody to know about it. And so the size of this movement at this point, I think, is very difficult to gauge because there are so many who are participating in it in secret.
I see. Yeah.
Yeah, this slide is fun. If you go back one slide, that'll refresh in everybody's mind what my website looks like.
Okay.
There you go. So there's my website. You can see under surgery pricing, it says click on an area of the body, blah, blah, blah. Now go to the next one. There you go. Under procedure pricing, click on an area of the body where blah, blah, blah. But if you look at the very top, it's uclahealth.org. This is not my website. Wow. This is UCLA's website that they copied off of mine and didn't ask me. And I didn't, everybody wanted me to sue them. And I said, no way. If I sue them, I'll have to shut up afterwards. I'm going to have so much fun with this. I'm going to show everyone. Now, UCLA did not post this website because they are really good people who are interested in delivering value. UCLA posted this website because they had to, because there were so many people that were coming to Oklahoma for their surgery from California.
Whoa.
They did this in self-defense.
Okay.
So I did not go after them for any kind of breach or copycat plagiarism, because I wanted in talks like this to post this up here and make fun of them and just laugh at them. And if there had been a lawsuit, I would have had to shut up. And this is way too much fun.
You only live once. Well, Heath, I do see a couple of questions coming in, and I do want to invite some of those questions. It's 11:36. We've only got about 20 more minutes left. But before that, I do want to thank you, Dr. Smith, for really going in deep on this free market approach. You know, growing up in America, going to school thinking that, you know, it's all about capitalism and the free market, to walk into healthcare and realize that things are done differently was always a big surprise for me. And so it really does turn on some light bulbs for me, Dr. Smith, when I hear what you've done. So kudos to you for spending the last, 25 years
Yep.
working to make healthcare more transparent. Heath Potter, everybody, 6 Degrees Health. What do you got for us?
All right. It's my special time in the program where I get to read off questions. So appreciate you guys having me back. So we got 3 in here, but by all means, I think we'll have a couple minutes more for additional ones if anybody wants to send something in. But the first one that came in, first a statement. I love the concept. How do you how do you make sure that surgeons have good outcomes? Are you tracking any metrics, or have you created any of your own?
Yeah, and that's a great question. The best way to make sure surgeons have good outcomes is for everyone who participates in the bundle to be bound by it. And what I mean by that is if we perform a surgery at Surgery Center of Oklahoma and it goes haywire, then we stand good for that. So the reason that's important is that you understand that keeps me from offering any kind of surgery where I know that there's some participant in the bundle who is not the best at what they do, because I'm at risk. So if we, for instance, if we had a surgeon, and I would not allow this, because remember, our first rule was we won't let anyone operate at our facility who wouldn't let operate on us. If somebody started having complications regularly, they just would not be doing those procedures anymore, because I'm financially at risk, because all of the buyers know that we stand behind what we do. So, you know, the buck stops really with the facility, whoever is standing behind the bundle. I think you have to be careful with the people who claim to be measuring quality. You have to be careful with people who report quality results. It is very easy to game those numbers. Almost all of it is self-reported. Some of the quality companies that claim to be talking about quality are pay to play. If you buy a nice big fat ad on their website, then you get better marks. So I think you have to be careful with that. And I think the best, if you really want to go deep and read about the problem with quality measurement, then read my friend's book, Marty McCary's book called Unaccountable. Marty's the scientist. Marty was Steve Jobs' pancreas surgeon. He's Hopkins trained. He's a brilliant guy. And he wrote this book with the idea that he could go in and measure quality. And by the end of the book, he's thrown up his hands. And he's basically saying, it can't be done. So many lies out there, not just on the reporting side, but on like by the sellers in the marketplace, by those who compile. And so at the end of the book, he throws up his hands and says, if you want to know if Cleveland Clinic is really good at heart surgery, then you should poll the people who work there and see if they would have their heart surgery done there. So somebody sees Cleveland Clinic and they think, I want to go there and have my hip replaced. they're out of their mind. And Marty makes that point. Cleveland Clinic is one of the worst places to go have your hip replaced. It's a great place to have heart surgery. So if you poll people there, would you have your hip replaced? Then they would say no. So I caution people to be very comfortable. If anybody in government says they know the first thing about quality or measurement, you can forget that. You can know absolutely for sure that anyone in government who says they know anything about quality is misinformed or just lying.
All right, thank you much. Quick one, where is the facility in Utah that you mentioned?
I think it's the name of the city is St. George. I think it's St. George Surgery Center. And there's a nurse anesthetist up there who read about my facility in a magazine called Outpatient Surgery. And he called me and said, can you help me do this, or can we copy what you've done? So I connected him with my web designers and said, go for it. So, and I do this all the time. I did it with Wellbridge too.
Okay.
So I think it's called St. George Surgery Center. They have a website with pricing listed.
Excellent. Okay. Question: CMS, HHS, DOL, i.e. the feds, how are they part of the problem? Isn't it just greedy hospitals, drug makers, and providers that got us here?
Well, the government, they screw everything up, and the hospitals, like I said, they can't do what they do without buying all these favors. Everything, whether it's the certificate of need that the Fed started, whether it's pricing. So the pricing at the local price gouger hospital that Medicare pays that hospital is double my online price at Surgery Center of Oklahoma. What Medicare would pay my surgery center for a procedure is under my cost. And that's intentional. That is meant to drive business to the price gougers. So there are just all these shenanigans. The Department of Labor, the way that they just terrorize self-funded plans. You could abolish, I'm with Ron Paul, you could abolish the Department of Labor and everyone would just breathe a sigh of relief. But the federal government, they are in the business of selling favors. And I encourage people to look at the federal government truly as a predator, and we are the prey. This is not a new concept. Book by Franz Oppenheimer called The State, I think really pulls the curtain back and helps people understand what the real purpose of the federal government is. And it is not to protect us. It's not to help us. It is to help their friends who pay them. And they've screwed up the industry. Medicare is a disaster. Medicare it's bankrupt, and they pay too much for many things, and then they underpay for a lot of things. But the purpose of that is to either ration and deny care, or to make sure care goes to the more expensive venues and the people who paid their bribes.
Okay. I think this next one's pretty closely related to that, but I'll save that to the end in case we've got time. Okay, someone says, I talked to a lot of surgeons who are afraid of posting prices for their direct contracts because they are afraid of losing their buca business. Is there any advice you can give them?
Well, I've always found it interesting that a man who will pick up a knife and slice someone open is one of the most fearful people out there, and those are surgeons. And so surgeons are fearful of a lot of things. They probably have talked to a healthcare lawyer who has told them they need to be afraid. The boots on the ground answer is this, and this has worked successfully. Whenever Blue, whoever has an issue with a price, the answer is will you pay me in 5 days? Will you guarantee me there are no clawbacks? Will you guarantee me that there will not be a big battle for medical necessity pre-op? Will you guarantee me 100% of my fee where I'm not chasing the patient for the balance? The answer to all of those questions from Blue Cross or whoever is going to be no. And so therefore, it is not the same. It is not apples to apples. It's not even apples to oranges. It's more like a fruit to a vegetable. It's not even close. So the surgeons who are afraid of losing their BUCA contracts, they need to understand that what they're offering with a cash option is so different that it is not even to be compared.
Okay. So I think most people probably understand the freedoms that, you know, an unbundled RBP type plan provide and allowing you to do something like this with you. But the question here is, if a member, how does a member go about getting a surgery or procedure completed if they're using, you know, Blue Cross Blue Shield or United Health Group or something like that? That's part one of this question. Then I've got a couple follow-ups.
Well, I don't have any carrier contracts at Surgery Center of Oklahoma. I tell people now, when I was young and foolish, I thought those relationships were a good thing. And now I know how stupid that was. Blue Cross United, they want nothing to do with this. They want the charges to be as high as possible so that they can skim on the repricing. So the networks have no place in what I'm describing. Having said that, I was told by the president of a large carrier in a different state that he thought the time was coming when a carrier would approach me and actually want to buy at my pricing, and I needed to be ready for that conversation. I don't think that's going to happen. But the way this works for an employer who wants to keep their network, they can still buy. They can still buy directly. Jay Kempton devised a concept that is used widely now in the United States called a bolt-on, or you can call it a carve-out. And you know, the carriers are pretty much okay with this. They know that if they do not allow the health plan to act in a smart way as a fiduciary, that they risk losing their business to another network who will. So using this bolt-on carve-out sort of methodology where an employer plan can keep their network, but buy in a parallel way next to it, waiving all deductible and copay to provide the incentives, that is so widespread now that I'm hoping that's getting at the meat of this question, but that's how it works.
Okay. Part B of this, not totally related, but can you do this for emergent surgeries, or is it just primarily for electives?
Yes, we can do this for emergent surgeries if the patient goes to a hospital that understands the game. So the patient goes into the hospital through the emergency room, and they know when the patient walks in that this one is to be billed to Atlas Billing Company or whoever the intermediary is who is dealing with the bundle. So after the emergent surgery, Atlas Billing is invoiced by the hospital anesthesia surgeon, put it all together, invoice the self-funded plan, and typically the amount is a fraction of what they would have paid going through the network, because the hospital constantly wants to curry favor with Atlas or whoever, because they want the elective business too. And if they price gouge in a situation where someone's vulnerable, they know that I will rightly hold that against them.
Okay. Average wait times for elective surgeries?
That's the favorite question of a Canadian. How long do I have to wait for this? My good friend in Vancouver, who obviously is Canadian, he said the old joke is no Canadian is truly happy unless they're standing in line. Now, it's got to be true. There are no wait times. If somebody wants surgery this week, they can have surgery this week. In a free market, that means there's competition. And competition is a great thing. It holds all of the sellers accountable. Because if I tell someone that I can't get to their child's tonsillectomy or cochlear implant for a month, and I know there's a good chance they're going to find someone else who will do it inside of a month. So there's not only a desire and a need to provide great care, but to provide great care in a timely fashion. I got a call this morning at 5 a.m. from someone who is in an emergency room here in town, and they said, we've got a patient here who is part of an employer plan who needs their gallbladder out today. Can you do it? That was at 5 a.m. At 7 a.m., that patient was asleep, and the surgeon was taking their gallbladder out for the price that I have listed on our website. So these things, it's very nimble. There are no wait times. If we need to stay later, we stay later. If we need to come into work earlier, we do. The day just gets longer. There really aren't any wait times.
Heath and Dr. Smith, we've got just a few minutes left. I do see a couple of great questions that just popped in. So Heath, if you can just go through a couple of those before we conclude the episode.
Yeah, let's do a rapid fire here, and maybe we'll just give a real quick response to some of these and try and get some answers. But how does a patient handle surgical follow-up? Do they come back to see you?
Yeah, so surgeons typically will talk to the patient or FaceTime with them afterwards if they don't live in Oklahoma. Otherwise, the surgeon checks out to the primary care physician in the patient's hometown.
Right on.
Okay. What other patterns have you seen to be successful in bundling outside of incorporating a travel program? What are the practices to avoid?
I think one practice to avoid is for an employer to think that has been almost without exception a disaster. Third-party administrators that have this sort of travel concept in-house, and there are concierge travel companies that help with that. That is what I would avoid, is the conceit of thinking as a company we can manage the travel benefit ourselves. That's not worked out well.
All right. Have you seen anyone doing this for cancer treatments?
Yes, we deal with oncologists who are willing to treat the drugs, the chemotherapy drugs, as a pass-through with no markup. And they just charge a reasonable fee for administration. And same with radiation therapy. You get down to where you decide there's this price per treatment. And at this point, I believe this many treatments make sense, and everybody agrees to it with the understanding that if more treatment is needed, then you have another conversation. But cancer is easily part of this. Cardiac surgery too. You can buy an open heart surgery in Oklahoma City for $34,000. Result second to none.
Wow.
All right. Gray, we still good, or we got to wrap it up here?
I think we should wrap it up. Thanks, folks, for all your comments. A couple of comments came through as well. Appreciate those very much. We are out of time. I do want to thank everyone for being here, specifically Dr. Smith. thanks for opening our eyes to a new way of looking at pricing, a new way of paying for services. It's really great to hear from you and that there are options out there. So thank you, Dr. Smith. Appreciate you very much.
Thanks for having me. I appreciate the opportunity and appreciate what you guys do. I've got an RBP plan at Surgery Center of Oklahoma. So I appreciate what you guys do.
Folks, we are 6 Degrees Health. We do work in reference-based pricing. We have some other solutions as well. We do clean claim reviews under the payment integrity umbrella for those large, complicated, catastrophic claims. Reach out to us, Heath Potter. He's our Chief Growth Officer. He can help you with that. We will be sending a follow-up to today's episode. We will be sending you some information about that. We've got a really exciting month coming up in September. We're being joined by Ernie Clevenger. He is the president of Care Here, and he publishes I believe it's a monthly newsletter, My Health Guide newsletter. And he's going to be joining us, and his focus is going to be primary care. We're going to really be looking at America's best kept secret, which is primary care. I love getting into this. We've talked about direct primary care in the past. Specifically, we're going to be talking to him about primary care being so critical to the success of a health plan, folks. Get excited. Ernie Clevenger will be here next month, Tuesday, September 20th. It's at 11 a.m. You can register online. Again, we'll be sending out some information on that. 6 Degrees Health, so stoked to be a part of the healthcare industry, the benefits industry. So glad you all came here today. We will see you next month at our Fireside again, folks. Take care.
Thank you, Dr. Smith.